I'm often asked by patients, can my cancer reoccur? And the answer is yes, it can, and let me explain. What is a reoccurrence of breast cancer? Well, the reoccurrence can occur fundamentally in two locations. One, within the treated breast if a patient's had a lumpectomy, or it can reoccur elsewhere in the body. Reoccurring elsewhere in the body is called a systemic failure, meaning it's gone elsewhere within the body. That patient is now stage 4 when it reoccurs elsewhere in the body. And people say to me, well, how does that happen? And again, because you shed off cancer cells, that we know that that goes on for months and months before you ever meet people like me. The good news is the majority of those cancer cells don't do anything bad, but it's the few that can. It's like throwing the grass seed out the window. It's the few that may grow that we worry about. And if they do and present themselves in the liver, lung, bone, brain, places like that, that's called a systemic failure, or another medical term is distant recurrence, in other words, elsewhere within the body. And the treatment of that has already been discussed, and I will not repeat it. But then it becomes the question, what about a local recurrence? And typically a local recurrence is in somebody who's had a lumpectomy, or potentially a local recurrence can also be if somebody's had a mastectomy, and then the cancer has grown back at the mastectomy site. And people ask me, well, how in the world is that possible, Dr. Ernest? Well, these circulating tumor cells can almost be like homing pigeons. And there's some science now showing that they may have a tendency to want to come back to where they were originally as they circulate around the body. And we have certain very aggressive forms of breast cancer that have a real tendency, even after a mastectomy, to want to locally recur at the mastectomy site or within the breast. And then with that kind of recurrence, either at the mastectomy site or here in the chest wall or within the breast, typically then we will, if we didn't do it before, we would add more surgery, we would add radiation therapy, probably chemotherapy, etc. Our great worry about in-breast recurrence or recurrence locally is that it may be a little flag waving around saying it's now going to occur elsewhere in the body. And so we take recurrence of breast cancer very seriously. When you come and visit people like me on a regular basis, we're looking for a recurrence. When you get your mammograms every year, we're looking for the potential of recurrence at the site. And your medical oncologist has ways of looking for recurrence elsewhere in the body.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.